how did you hear about the X39, Dr. Hoyt, and what was your experience in the beginning for you?
A longtime friend and patient of mine, Kay Harrison. She had emailed me a few times about the patches, and I'm very interested in stem cells. So when I saw information about stem cell, I thought, well, we'll take a look at this and see what they've got. So Kay told me about it, then I got introduced to John Harmon, and so it went from there.
And then for how long ago was that?
It's been about 3 months, maybe 3.5, 4 months.
So when she, so did Kay send you the patches and you used it? What was your experience?
Some patches. I tried some of the pain patches, the Ice Wave, and I had a number of patients that were having either back pain or headaches or rotator cuff injuries. I had just taken on a case of a patient with chronic pain. She'd had 4 spine surgeries and she was on heavy amounts of opiates, and her goal was to get off. And she's in a wheelchair, by the way, and she's about 75. And so I thought, well, this is a great case to try out some of these pain patches. I don't expect a lot, but let's see if we can reduce it. And she had immediate relief. She went from, let's say, an 8. Well, she was probably more like a 10 times 3. But her pain went, we'll say, from a 10 down to a 6 and a 5 in some areas. And she's been using them now for 3 months to manage her pain while we're doing other functional medicine things to help clear up her liver and other organs so that she can remove toxicity from her body. But that was my first introduction, was using the Ice Wave on a chronic opioid patient with multiple spine surgeries and fusion.
Wow. Have you had a personal experience yourself?
Yeah, so I delayed trying the patches on myself because I was, a lot of my strategies and learning I'll test out on myself. So I've been tracking my own blood work, and I had several different cycles that I was in the middle of when I was introduced to the pain and stem cell activation patches. So I thought, I got to finish up these cycles. One was just killing off candida and yeast problems, and another was rectifying cholesterol and inflammatory markers in the blood. So I wanted to see what I could do with these different supplements, and I had set up a protocol and a regime, and I was testing every 3 weeks. And so when I finished all that, my tendonitis that was in my right elbow was still there. It's been there for 4.5 months. And prior to that, I was doing probably 4 sets of pull-ups or chin-ups 3 times a week. And then out of the blue, I developed tendonitis in that right elbow. And I was at that point unable to do any pull-ups. It felt like it would tear. It was excruciating. So I thought, well, I'll continue going through all these nutritional protocols that I'm doing and testing my blood. Certainly it's going to go away with that first. Before I try stem cell, I want to be unequivocally convinced, if it works, that that's what it was that did it. So I let my tendonitis fester for 4 to 5 months, and it shut down my workout. So basically on September 21st, I had tried all my other options. I'd done deep tissue therapy on it, active release technique. I had done turmeric for inflammation. I'd done candida cleanse to reduce inflammation. And I had some physical therapy things available to me, but I felt like I'd tried pretty well to do this. And I was testing the waters, trying to do pull-ups, and every time I'd try, it would just burn and felt like it was going to tear. So I couldn't do it. So I started on September 21st with stem cell activation, X39. And then I added at the same time the carnosine patches, because I briefly went onto the site and I said, okay, that's muscle. I've got a tendon problem. So it helps with strengthening. It helps with agility, physicality. So let's give this a shot. So within 12 days of putting the patches on, I took my grandkids to the park one night, and that was 8 days ago. And I thought, well, the monkey bars are there. I'm going to do some pull-ups and see how it feels. Well, I knocked out 4 pull-ups and no pain. And I had no pain after. It felt really good the next day. So I was kind of surprised. I thought, well, I can't complain about that. Let's give it another shot. So then the next day I knocked out 8 pull-ups and then 10 the next day. And this past Sunday I was at the park and I knocked out 15. I had my son-in-law video me because I didn't want to miss this if it was documentable. And this morning I knocked out 17 and a half pull-ups, which my max is 18. When I was a young 35-year-old guy, I could do maybe on a good day 18. So here I am 57 and I would have hit 18 today if it hadn't been for a hamstring cramp that I got, a spasm in the middle of pull-up 11, but I still toughed it out all the way. Because my thinking is I want it undeniable. So if I can knock out as many pull-ups as I've ever knocked out, and these are full extension pull-ups, no bent elbows, like these are full lockout pull-ups, no cheating. And if I can do the most I've ever done at 57, then this is pretty spectacular. So I'll report back to you in a week, but I expect to hit 20 by then.
So
that's a little personal, it's anecdotal, but for me, it's significant.
So since September 21st, today we're already at October
13th.
So we're talking about 20 plus days, right? So this undeniable evidence or proof of how the X39 works, how revolutionary is that for you?
Well, this will encourage me to use it for physicality. I thought I was going to start the carnosine for muscle building. I'm kind of a thin-framed guy. It's hard for me to put on muscle mass. So, but reading the carnosine, I was super impressed on some of the research. It talks about within 1 hour of applying the patch, a demonstrable increase in physicality. And they're talking about strength, agility, flexibility, speed. So I thought, and then in 2 weeks, it was really an undeniable improvement in physicality. So I thought that was pretty cool. And hey, if I can put on some Arnold at the same time, that'd be great. And then if I heard you were 6 months ago, you were bald. So I'm really excited about where the X39 is going. Well,
wow.
So my practice, Peter, is largely dealing with patients with autoimmune disease. So interesting, as a chiropractor, I began developing my own autoimmune problems and had severe cold sensitivity. I was wearing thick socks to bed in the middle of summer, and my strength and stress and just the pressures of work and whatnot, I was keeping too hard to schedule, and that was part of it. But so I began taking what I was already doing in the way of nutrition to the next level, and I hired a group and worked on learning a ton of nutrition and labs to help these patients. And so fast forward now from 2013 to 2020, and we're seeing lupus and rheumatoid arthritis and diabetes, even patients on pumps, insulin dependent. And so I've been very excited. I signed up, I got like $1,700 for the product. I forget which grade that is, but what level that is. But I wanted to test the product on my patients. I wasn't worried about this as a financial investment. I wanted to see outcomes. And so, we've got some really severe cases that I tested it on first. And so one of them is a 40-year-old female who's kind of a miracle in and of herself, but it's a long story. But she's just suffering terribly with no energy. She has severe overgrowth of candida. And every time we would work on a candida cleanse or kill with her, she would break out in boils, her hair would fall out, her energy would go into the floor. And so we've been using the stem cell activation patches with her now for about 3 months, and her hair is growing back in. She's on a very tight budget. Her skin looks a lot better, no more breakouts. Her energy is so much better, but financially, it's really hard for them. They live on a ministry budget and in an apartment, raising 3 kids. And so she dropped off for 2 weeks off the patches until her husband sent her back in, complaining that he was finding gobs of hair around the house. And even just talking to her, it would fall out. He could see it floating through the air. And he said her energy was not like it was when she was on the patches. So she just came back to us 3 weeks ago. And in fact, she just signed up on the weekend to on the preferred, what do you call it? The premier
preferred customer.
Preferred customer for the auto ship, but she wants to be a distributor. She's hoping to cover her expenses through distributorship. But anyway, so we've seen a number of cases like that where the patients are feeling improvements. I had a patient who's got multiple sclerosis, and we feel that one of her underlying, and just tell me to stop if you want me to, if we're done, if you want me to back up.
Keep on going.
Okay.
We got.
So this particular patient has had, she's had multiple sclerosis for years, and it just came to me miserable as kind of a last ditch effort. And I told her I thought we could help her if we could find the underlying root causes. And in fact, we've made a lot of improvements. At one point, she said she can't believe how well she is feeling, and it's been a long time. But there was still this underlying problem. She continued to experience UTIs. And I believe this is the underlying root cause to a good portion of her imbalance in her immune system that's leading to this fire that burns within her that we're calling multiple sclerosis. And so I tried everything I had nutritionally to fight this, D-mannose and cranberry and a pill that we call UTI Synergy and UTI Acute. And I had her on several other natural supplements that are supposed to kill bacteria and E. coli and whatnot. And she just continued to get these. I was testing her weekly, and she'd have a +3 in her urine of white blood cells and white blood cell esterase. And so I was at my wit's end, and I said, well, look, we just got introduced to this company. We're going to put the stem cell activation patches on. So, this was 5 weeks in a row of these infections. And lo and behold, this was, once we put the stem cell activation patches on, she is now 6 weeks, 8 weeks now with no infection in her urine. Is that the stem cell activation? It's the only thing I did different. So I can't prove it, but we're certainly grateful for the help. Because this is a patient that probably could have really lost her momentum and kind of fallen off and deteriorated.
So, with these short period of months since you joined us, and I know now that you've seen for yourself through your patients, I mean, in your whole career, in your life, being a doctor, have you ever seen anything like this before?
This is certainly, well, first of all, I will just say that I tell my patients regularly that stem cell technology is probably the most revolutionary thing that I've seen in medicine in the last 20 years. And so prior to introduction to the X39 and to this company, I was very interested in stem cell and had sent patients for stem cell and was hoping to do stem cell on a Achilles tear that I experienced, a muscle Achilles junction tear, sometime here soon. So now I'm hoping that maybe through the stem cell activation patches, I won't need that actual injections of stem cell, but I can get it through the patches. But We're 3 months into it. I continue to use the products and expect to see results in my patients. There are some patients that haven't been able to see a noticeable result, but I've told them they ought to give it 6 months to really get a really good pulse on it. But many patients have had noticeable outcomes, and I'm going to continue to, today, I'm very excited about glutathione.
All right.
Some of my first research that I did when I got introduced to LifeWave was on the glutathione patches. I know how glutathione works. I use it routinely on all my patients when I start a detox program to clear their system before we go into the specifics of what we need to reverse. And so when I read in the research and the science on the website that glutathione in 2 weeks period of time was causing a very, quote, very significant notice or improvement in pancreatic function, adrenal function, liver function, kidney function, pituitary function, all of the organs with which I'm working, I was pretty shocked when they were talking about 75 to 95% reliability for a very significant improvement. This was tested out of the University of El Paso, Texas, using electric biofeed or bioimpedance. So that blew me away. And then this last week, John Harmon told me that he had read that orally you can only boost the glutathione in the body, which is the natural antioxidant. If you don't know what glutathione is, I mean, it's a natural antioxidant that's produced in our bodies to balance out the free radicals that are being expressed in our body and to prevent cancer and virus and infection from doing terrible harmful damage and oxidation when oxygens are being released. So we're designed to produce our own, but it can get thrown out of balance, and as we age, we diminish. Just like stem cells, the amount of glutathione diminishes. And so orally, we can increase it by 20 to 40%, but he told me that he had read that you could increase it by 300%. And so I was shocked by that. So I dug back into the scientific papers on the website, and I did find the article that said the average increase was 265%.
Wow.
But in a depleted individual, as much as 450%. So we validated what John was telling, Dr. Harmon was telling me, which is always important to me. So I have begun using, this week I placed my first glutathione sleeves with patients, and we're probably going to see enough change that we're going to reverse, or we're going to probably start putting patches, glutathione patches from the outset on some of our really extensive autoimmune cases of lupus and Hashimoto's and rheumatoid arthritis and so forth from the outset instead of the oral. And it's actually, the pricing is actually similar, if not a little less expensive. So
awesome. Wow. That's awesome. I know this costs money, but in your world, how affordable or really effective is this? And you know how you can compare price, and we all know you can't put a price on health, but how effective these are. Where do you see this going in the future in what you've seen so far?
It's a great question, because I've had a lot of thoughts about this. With my patients who are very sick, when they come to me, they have no energy, they're depleted, they have depression, anxiety, and weight gain, unexplained weight gain, inflammation, arthritis, fibromyalgia, mental cognitive decline, and they're in their 30s and 40s, and they're suffering. So with a patient like that, in a 6-month program, we will exhaust $2,100 worth of supplements, reversing their condition to the best that we can, governed by what the blood testing, the gastrointestinal panel, the adrenal and hormone panels and the food allergy panels, which are pretty common assortment of panels that we run on these patients in the beginning. We'll exhaust 2,100, and then they'll, to maintain their results. Of course, we do significant dietary changes and whatnot, but they're literally spending at least 200 to 250 a month just on nutritional supplements. By the time you add up fish oil, vitamin D, a multivitamin, and depending on whether they got to rotate through another bacterial overgrowth kill, or they've got to continue on a probiotic or a B12, so they could be $200-$300 easy a month. And so I'm looking at this saying, if we can improve organ function with a stem cell activation patch or a glutathione patch, and I haven't even really learned about the other YH patches yet, so I'll get into those as time goes. But if we can improve function, I suspect that it's going to be more efficient, more cost-effective, and a deeper healing of multiple organ systems. I don't know if it can actually replace minerals and vitamins.
Yeah.
It seems kind of unfathomable that it could, but if it can increase organ function in the way the research is showing, then I'm very excited about the affordability of the patches. Stem cell, as you know, if you go for a stem cell injection, I have friends that do this. For my calf, it's going to be a $2,500 protocol to run that, and there's no guarantees. So it's a cash practice. Yeah, I'd like to get a few more cases under my belt, get some more patients on it. I was excited this week to discover that I can test glutathione levels through the lab that I'm using. So through a simple blood draw, we can test the glutathione. It's about $80, but I'd like to test that on some before and afters on some patients. So